The man in the chair hadn't slept in 11 days. Dr. Elaine Marsh could tell by the way he held himself. Not tense, exactly, but vigilant. The kind of stillness that comes from someone who has trained themselves not to blink too long. His name was Martin Hale, 43, a former high school history teacher from Knoxville who had stopped going outside 8 months ago. His wife had made the appointment. She hadn't come with him. "Tell me what you see, Martin," Elaine said, her pen resting against her notepad. Martin looked at the window, then at the corner of the room near the bookshelf, then at the space just behind Elaine's left shoulder. His eyes moved in a specific pattern, she noticed, not randomly, systematically, like a man doing a security sweep. "They're here right now," he said. "3 of them." "Okay, describe them for me." He exhaled slowly. Long, too long, like someone took a person and stretched them until the proportions stopped making sense. The skin is dark, not dark like a shadow, dark like something that absorbs light, like looking at a hole in the air shaped like a body. Elaine wrote, elongated, absorbs light, patient presentation. And the faces? Martin's jaw tightened. No faces, just a vertical seam where a mouth would be. And above that, he paused, a cluster, like someone had taken 50 eyes and pressed them together into one mass. All of them moving independently. All of them looking at different things at the same time. "Are they looking at you now?" "One of them is," he said, "the one behind you. It's been watching you since I sat down." Elaine didn't turn around. She had learned early in her career that turning around validated the delusion in a way that was difficult to walk back. "What are they doing?" "The other 2? Standing near the window. They do that. They like glass, I think. Reflective surfaces." He rubbed his hands on his knees. "They stand near things that people look at. Mirrors, screens, windows. I think they like being almost seen." "Almost seen," she repeated. "People look at their reflection in a window, and they don't see the thing standing right next to them in the glass. They're right there. But people just..." He made a gesture with his hand, something between a dismissal and a helplessness. "Look through them." "Martin, when did you first start seeing them?" He thought about this seriously, which she appreciated. Some patients gave immediate answers that were clearly rehearsed. Martin treated every question like it deserved real consideration. "About a year ago, I was driving home from school on 40, and I saw one on the overpass, just standing there. At first, I thought it was a person, someone in trouble, maybe. I slowed down." He looked at his hands. It turned and looked at me, and I understood immediately that it wasn't a person, and had never been a person, and didn't understand what a person was, except as something to stand near. That must have been frightening. "No," he said, and the honesty of it surprised her. "Not at first. At first, it was just clarifying. Like when you're looking at one of those optical illusion pictures, and suddenly the other image snaps into focus, and you can't unsee it." He paused. The fear came later, when I started seeing what they do. Elaine leaned forward slightly. "What do they do, Martin?" He was quiet for a long moment. "They stand behind people," he said carefully, "close. And they put their hands, if you can call them hands, into people, not through them, into them, like the person is a coat they're trying on. And the person just..." He stopped. "Just what?" "Just keeps going. Keeps walking and talking and eating lunch. Doesn't feel it. Doesn't know. He looked at her directly for the first time since sitting down. But afterward, they're different. Just slightly. Like something in them has been adjusted. Turned down a little. Elaine wrote, insertion delusion, paranoid ideation, invisible influence, possible early onset. I know what you're writing, Martin said. She looked up. You're writing that I'm paranoid, that I have a delusional disorder with somatic features. He said it without bitterness, just recognition. I've been to 3 doctors before you, Dr. Marsh. I know the terminology. Does that concern you? What concerns me, he said slowly, is that none of you will look. You all ask me to describe them, and you write things down, and you prescribe things that make the edges soft, but don't make them go away, because they're not going away, and not one of you has ever just turned around. The room was quiet. Martin? There's one right behind you, he said. It's been there for 20 minutes. It put its hand into your shoulder about 10 minutes ago. His voice was steady and sad. You rolled your neck to the left twice since then. You've been rubbing your left thumb against your index finger without noticing. You do that when something hurts, but you're trying to stay professional. Elaine stopped moving her thumb. She hadn't noticed she was doing it. That's, she began. Turn around, he said quietly. Just once. Just look. She didn't turn around. She wrote, patient displays observational acuity, maybe reading micro-expressions and physical cues to reinforce delusional framework. Recommend increased session frequency and adjustment of current medication. She walked Martin to the door herself. Her assistant, a young woman named Claire, was waiting outside with his file. How'd it go? Claire asked after Martin had been escorted to the elevator. Complex case, Elaine said. Persistent visual and somatic delusions. High functioning, treatment resistant. I want to see him twice a week. Claire nodded, making a note. Should I flag it for the observation unit? Not yet. Let's try the outpatient route first. Claire hesitated. Dr. Marsh, I know this is going to sound strange. Go ahead. That patient, when he was in there. She glanced toward the closed office door. I was sitting out here the whole time, and I had this feeling, like something was in the waiting room with me. I kept looking up. She gave a small, embarrassed laugh. Probably nothing. I think I need more sleep. Elaine looked at her assistant carefully. Claire was rubbing her right thumb against her index finger, back and forth, without noticing. Get some rest, Elaine said. We all do. She went back into her office and closed the door. She did not turn around, but for the first time in 22 years of practice, she wanted to.